Welcome to The Explainer. I'm absolutely thrilled to have you here today because we're going to explore a truly fascinating approach to human psychology. We often tend to think of our psychological distress as some kind of unchangeable flaw or maybe a deeply buried mystery in our subconscious. But what if a lot of our distress simply stems from faulty learning? Think of it almost like a software bug in our brains. What if the bad habits, the anxieties, and those destructive routines we constantly fall into are just poorly programmed behaviors? Behaviors that we can actually actively rewrite. Well, that's the foundational magic of behavior therapy. Today, we're going to step into the role of behavioral detectives. We're going to learn how to identify the root triggers of our distress and then use some highly targeted techniques to literally reprogram our actions for healthier life. Okay, let's dive into this. Here is our roadmap for today. First, we'll cover the focus on the present. Second, the behavioral analysis formula. Third, mastering reinforcement. Fourth, breaking unwanted habits. And fifth, conquering deep fears. Section 1, the focus on the present, leaving the past behind. To really grasp the philosophy behind this therapy, I want you to stop and ask yourself a pretty frustrating question. Why do we keep doing things that cause us distress? Seriously, why do we bite our nails down to the quick when we're nervous, or completely avoid public speaking, or absolutely lose our temper when we know for a fact it doesn't help the situation? It's honestly one of the most maddening aspects of the human experience. We know a behavior is maladaptive, yet we feel completely powerless to stop it. Now, this is where we see a massive shift is psychological thinking. If you were to visit a traditional psychodynamic therapist, they might tell you that your current distress is the result of unresolved childhood fears or maybe deeply hidden, unfulfilled desires. You could spend years, literally years, digging for your past trying to find some grand emotional insight. But behavior therapy, it says something radically different. It argues that psychological problems arise simply because of faulty learning. That's it. The past is only really relevant to understand how that bad learning started in the first place. In this therapy, the past isn't activated and it certainly isn't relived. The therapist is only interested in rolling up their sleeves and correcting those faulty patterns right now, in the present. Section 2, the behavioral analysis formula, investigating the scene. So how exactly do we fix these patterns in the present? Well, we have to put on our detective hats and investigate the scene. When a client walks in feeling distressed, the therapist starts with a clinical interview to perform what's called a behavioral analysis. And let's see how this builds, because there are 3 very specific steps here. Step 1, find the malfunctioning behaviors. These are the specific actual actions causing the client distress. Step 2, identify the antecedent factors, meaning what are the exact situations or triggers that predispose the person to indulge in that behavior. And step 3, identify the maintaining factors. Now, I want to spend a moment on that third step because it's absolutely crucial. Maintaining factors are exactly what they sound like. They are the factors that lead to the persistence of the faulty behavior. You can think of them as the invisible glue keeping a bad habit alive. We rarely do something distressing for absolutely zero reason, right? Usually there's some hidden payoff secretly keeping that behavior locked in place. Let's ground this formula in reality with a quick case study straight from our source material. Picture a young college student who has picked up the malfunctioning behavior of smoking, and he's finally seeking help to quit. When the therapist runs the behavioral analysis, it reveals that he first started smoking when he was cramming for his highly stressful annual exams. So the anxiety-provoking situation of exams, that's our causative or antecedent factor. But why does he keep doing it long after the exams are over? Well, he reports feeling a sudden sense of relief every time he smokes. That feeling of relief is our maintaining factor. He's acquired an operant response of smoking, which is being kept alive or maintained by the highly reinforcing value of anxiety relief. Section 3, Mastering Reinforcement, the Treatment Toolbox. Okay, so once we've investigated the scene, it's time to actually treat the problem. We want to extinguish those faulty behaviors and substitute them with adaptive ones. Let's clear up one of the most common confusions in psychology right now. Let's talk about negative reinforcement first. A lot of people think this means punishment, but it doesn't. Negative reinforcement is when a response allows an organism to get rid of a painful stimulus or avoid it entirely. For example, when it's freezing outside, you learn to put on a thick winter coat to avoid the biting cold. You are moving away from the pain. Positive reinforcement, on the flip side, is gaining a reward. We use this when a good adaptive behavior occurs rarely and we want to pump up those numbers.
For instance, if a kid hardly ever finishes their homework, a parent might use positive reinforcement by cooking the child's favorite dinner whenever the homework actually gets done on time. The food acts as the positive reinforcement.
And we can even structure positive reinforcement into a much larger, ongoing system called a token economy. The way this works is every single time a person exhibits a wanted behavior, they're immediately given a token as a small reward. Over time, they collect these tokens. Once they've stockpiled enough of them, they can exchange the whole shebang for a much larger reward, like a special outing for a patient or a massive treat for a child. It's basically like a frequent flyer program for good behavior, and it is a fantastic, structured way to substitute faulty behaviors with adaptive ones over the long haul. But what if a behavior is highly dangerous and needs to be stopped immediately? That is where therapists might use aversive conditioning, and this brilliantly illustrates the sheer power of classical conditioning. Aversive conditioning means repeatedly associating an undesired response with a painful or aversive consequence. Our text provides a pretty vivid example. An alcoholic patient is given a mild electric shock at the exact same time they are asked to smell alcohol. With repeated pairings, the brain connects the two. Eventually, the smell of alcohol itself becomes aversive because the pain of the shock is deeply mentally associated with it, and that powerful association helps the person give up alcohol.
Section 4. Breaking Unwanted Habits. Differential Reinforcement.
Now, aversive conditioning can be quite intense, obviously. Thankfully, there are much less painful and equally effective methods for changing our everyday habits. Enter differential reinforcement. There is a golden rule for this that you have to remember. Positively reinforce the wanted behavior and ignore the unwanted behavior. That's differential reinforcement in a nutshell. You are simultaneously trying to increase a good behavior while decreasing a bad behavior, simply by shifting how you direct your attention and your rewards. Let's look at a highly relatable parent-child scenario to see this practically functioning in everyday life. Imagine a young girl who sulks, whines, and cries every single time she asks to be taken to the cinema and gets told no. If the parent eventually gives in just to make the noise stop, they are accidentally reinforcing that exact tantrum. So, using differential reinforcement, the parent is instructed to take her to the cinema only if she politely asks without crying or sulking. But here's the crucial part. The parent is instructed to completely, 100% ignore the girl when the whining starts. So what happens? Well, the wanted behavior of politely asking goes up, and the unwanted behavior of crying and sulking goes down, because it literally no longer holds any maintaining power over the parent.
Section 5. Conquering Deep Fears. Systematic Desensitization.
Let's shift our focus to something heavier: debilitating, irrational fears and phobias. Decades ago, a psychologist named Joseph Wolpe introduced systematic desensitization. It's this incredibly ingenious, gradual process to slowly extinguish a phobia. It works in 4 steps. First, the therapist interviews the client to pinpoint exactly what provokes their fear. Second, together, they map out an anxiety hierarchy, putting the absolute least scary stimuli at the very bottom and the most terrifying nightmare scenarios at the top. Third, the therapist teaches the client deep relaxation procedures. Think progressive muscular relaxation, where you learn to tense up and then just completely melt and let go of every muscle group. Finally, while in this heavy, deeply relaxed state, the client is asked to just imagine the situation at the very bottom of their hierarchy. If they feel even a tiny spike of tension, they stop. Over many sessions, they maintain that deep relaxation while slowly, safely walking up the hierarchy to the more severe fears. Now, what's really interesting about this is the biological mechanism making it all possible. It's a concept called reciprocal inhibition. This principle states that the presence of 2 mutually opposing forces at the exact same time inhibits the weaker force. Think about it. You physically cannot be deeply, heavily relaxed and highly anxious at the same exact time. Your biology won't allow it. They are opposed forces. By first building up a massive relaxation response and then introducing just a mild anxiety-provoking scene, the anxiety is quite literally overpowered and overridden by the relaxation. Just briefly, another gentle tool in the behavioral toolkit for conquering fears is modeling. This relies on vicarious learning. Basically, we learn to conquer fears simply by observing others. The therapist might act as a brave role model, demonstrating a healthy behavior, and the client learns just by watching them, with small, step-by-step changes being rewarded along the way. Well, we've covered a ton of ground today, from the detective work of behavioral analysis to token economies and conquering phobias. But I want to leave you with one final provocative question to ponder.
Knowing what you know now about how our actions are shaped by our environment, what invisible maintaining factors are secretly controlling your habits today? I encourage you to take your new behavioral detective skills, apply them to your own daily routines, and see what you uncover. Thank you so much for joining me for this explainer, and keep learning.